technology is playing a very important role in our lives. How digital healthcare system has transformed the entire healthcare ecosystem towards patient-centric uh, ecosystem. And if you can also highlight, where do you see it, and what is the gap you can still witness?
Yeah, so I think the most important gap is that we need to be able to now scale up
Hmm.
the technology solutions, especially the AI driven solutions, or have very large scale use cases
Hmm.
of where AI, for instance, is being used to make sense of patient data so that we can improve the clinical outcomes for other patients.
Hmm.
So, this is particularly important in the case of rare
Hmm.
diseases because in rare diseases, uh, every doctor only will see a small number of patients, right, of that particular disease. So, there, if we can aggregate the data we have from different sources and then use AI to make sense of that, then we can improve outcomes for other patients,
Hmm.
who have those rare diseases. Because rare diseases are called rare, but in absolute numbers in India, it's still
Yes.
a large number of
Yes.
patients. So, similar to that, we need many more use cases
Yes.
of how we can integrate technology with the health system at scale.
So, when you speak about AI, okay, and since technology is now playing a very crucial role in transforming healthcare ecosystem, telemedicine, the digital healthcare, how they are shaping, the patient-centric digital ecosystem, if you can kind of kindly highlight. Yeah.
Yeah, so it is playing a role.
Hmm.
Like I said, telemedicine picked up a lot during the COVID pandemic. But again, we see some slippages. So,
Hmm.
once the pandemic went away, then people have the opportunity to again go back for
Hmm.
an in person consultation. So, people still prefer that.
Hmm.
When it comes to healthcare, they still want ideally the doctor to,
Hmm.
be able to see. So, we need to see how do we,
Hmm.
use technology when we don't have a crisis
Yes.
situation, and how do we make it a usual part of a patient's behavior. So, that is one side of it. The other, like I said, is improving
Hmm.
the clinical outcomes, making it a tangible reality.
Okay.
If
Yes.
I am a patient in some rural area in India, I
Hmm.
don't care whether you're using AI or you're doing anything else.
Hmm.
I care about my outcomes.
Yes.
So AI has to be used now in a very tangible
Yes.
sense. And I think that we're still some distance from doing.
Hmm.
It is still more of pilots
Hmm.
or some examples or some parts of the
Yes,
country where they are
definitely.
doing
Yes.
good work, but it's not yet
Hmm.
fully integrated, I would say, into our public health system.
So, since you are also representing NITI Aayog, okay, so the government has taken various initiatives. There's a national health policy of Ayushman Bharat. There are other initiatives. The government is also promoting technology. So, you know, uh, what are your views? I mean, do you think, there should be more policies, or which are the areas do you think some more policies should, unleashed or rather unveiled by the government so that it can be more patient centric?
Yeah, see, I don't necessarily think we need more policies every time, but it's better implementation also of what we have. Because a lot of policies in theory
Hmm.
mean well,
Yes.
and the idea behind it is good.
Okay.
But when we take it to the ground, and we have 1.4 billion people to cater to in a very diverse setup, health is still primarily a state subject in
Hmm.
India. So every state has their own way of doing things. Even if I have an Ayushman Bharat template of a scheme, every state will implement it in a very different way. So I think that rather than just bringing new policies, we need better implementation, but we do need more funding for our public health system because we cannot improve patient outcomes till then. Until we have a strong public health system backbone across the country, not just in South India, not just in Kerala or
Definitely.
Karnataka, but everywhere. And that needs more money also for the health system. And I think our public health system is grossly underfunded still. So I think that is where I would really want to see the government come in, is to ramp up spending, public spending on healthcare, and also then, as a way of improving public health facilities, strengthen the human resource base as well, because we still have shortages of doctors, we have shortages of specialists, we have shortages of paramedics. So this has to be the role of the government.
Mm.
And I think until we do this, we cannot build a strong backbone, because technology cannot replace the human being,
Yes,
cannot replace, in healthcare, it
yes,
can only
definitely.
assist.
So this is the only you when you speak about the challenges, you only see the challenges in terms of investment or doctors or any other additional challenges if you would like to highlight which you think needs urgent solutions
See,
digital if you can see any challenges.
yeah, I mean, investment, you cannot reach digital if you don't have the basic health infrastructure in place also.
Yes.
So you need investment at every level.
Mm.
Even for digital, you need a strong basic health infrastructure, right? Then only you will be able to build on top of that.
Yes.
So it's important to understand that digital is not a silver bullet solution to anything. It is an enabler in healthcare. And until you strengthen your basics and your backbone, which is in healthcare, of course, the physical infrastructure, the equipment, the devices, all of that, but also the human resource. The most important is human resource. You can have the most state of the art technology, but if you don't have a qualified doctor or specialist,
Mm.
it will not work. It will not really help the patients. So that is why I'm saying that everything kind of flows from the investment and the human resource. And then, of course, you build on it with the technology, whether it's telemedicine, whether it's AI. But I'm just saying that we have used these words for too long now, and we need to go beyond that. And if I'm a patient working in a hospital somewhere, I should know how AI has benefited me. Because if I don't know that, then these are just words and
Works.
jargons.
Yes. So, can you kindly speak about today's summit and event? What have you witnessed, and if you want to say something about Elets patient-centric events.
Yeah, I mean, I think the event was very interesting, and a lot of diverse stakeholders have come together. Whether it's people who are aware about technology, public health professionals, government professionals. So I think it's a very interesting event, and I really like the topic of patient centricity, because I think ultimately anything we do in the health system is for the patient.
Yes.
And so, this whole idea of being patient centric, I think, is coming out through the summit, which is, I think, very good job that the entire team has done.
Thank you, ma'am. Thank you
Thank
so
you.
much for
Thank
your
you.
time.
Thank you.